From VTV Channel 6 Studios in downtown Vernal, this is Local Point with your host, Chris Piner.
Welcome to Local Point, sponsored by Ashley Regional Medical Center. There have been many concerns regarding how different chemicals impact where and how we live. The TriCounty Health Department will give us an update on a few of the current topics surrounding our area. Joining me here in the studio today is Darren Brown and Jeremy Tubbs. And it's good to have you here. Let's start off a little bit by talking about the Tri-County Health Department. We hear that all the time, but Jeremy, what overall is the mission of the Tri-County Health Department?
The mission of Tri-County Health Department is really threefold in that we prevent disease, promote healthy lifestyles, and protect the environment.
Prevent disease, promote healthy lifestyles, and that's probably the one that we hear the most about, maybe. And this is the third one is
protecting the environment.
Protecting the environment. I didn't realize that was part of your effort. So that's good to know. Now you mentioned to me off camera that when people talk about Tri-County Health, it's mainly they think of immunizations and that kind of thing. But there's clearly a lot more going on. What are some of the other things that you'd like to know? You'd like people to know that you do?
Well, what we're here for today is when we constructed the new facility that we have, we implemented a lab in-house, and we have the ability now to test water samples to ensure that they're safe both for public and private consumption. For consumption?
Just consumption? I mean, are there any other reasons you might want to test water? I guess for swimming or things like that too?
Yeah, for safety concerns, anything health and safety.
Anything like that. So who might want to have their water tested? Who might do that or
well,
want that?
Right now it's spring and it's time for people to test their private water wells. We have private water wells all at Dry Fork and all around the different counties here. But it's a good time to test that well and see if you've got bacteria in it. Our lab right now is set up to do coliform tests and E. coli tests.
All right, I'm putting it together a little bit better in my mind then. So really we're looking at things like wells, especially? I mean, you're not talking about someone's tap water?
Well,
we need to have that tested?
We are, yeah. You can request that, but those tests are done all the time by the water system. So whatever public water system you're on, they have to collect so many samples a month.
I see.
And they collect those samples and bring them into our lab, and we test them for them.
All right.
And they're required to do that by EPA standards.
And this is something that you do right here locally, so I could say, hey, I've got a well, could you come down and help me out with this, check the water, make sure that it's safe?
It's a real benefit because you used to have to ship those out of the area
to another lab,
and then they had a 24-hour test time, and you would, if there was a problem, it was a long time before you found out. So now we can do an 18-hour test. You can bring it into our lab in 18 hours. We can tell you the results of it.
All right. Well, that's something that I definitely didn't know that you did or could do. We're hearing a lot about in the news, current events, the crises in Japan and radiation floating in our direction. Is this something that you're paying attention to or talking about? Is it even a concern or just a myth?
Well, of course people are concerned about it. Anytime you talk about radiation, there's a lot of public concern. The United States has a lot of monitors right now set up to monitor radiation. And those monitors have shown a little bit of elevation in radiation, but they're thousands of times below what we would consider a health risk. But we do have information to give out to people, and there are websites to go to that can give you real-time information. One of those, if you want it.
All right.
One of those is www.epa.gov/Japan2011.
Oh.
And that has some real-time stuff on there about radiation monitors, what's going on around the country.
Maybe if you just went to the EPA main site, there would be some kind of a link to that.
There would be a link to it, but that's a good way to find out what's going on out there. One thing you have to remember about radiation is those monitors, even the monitors we have, are very sensitive. And so they pick up very small amounts of radiation. So you don't get too excited when you see radiation amounts elevated. They could be way below it.
You expect to see it pick up something.
Yes,
then?
yes.
Okay.
My radiation detector will pick up something driving down Main Street.
Oh, okay.
So it's just.
But nothing that is a health concern. Otherwise, you would be the ones that would be notifying everyone, letting us know.
We would, and we actually have placed information on our website, and there are also lists of
You've got a
other.
website. We'll
Yes.
talk about that website in just a minute, right? After this brief message from Ashley Regional Medical Center.
Ashley Regional Medical Center now offers neonatal services and a Level 2 nursery, along with our quality obstetrical services. The Level 2 nursery provides state-of-the-art monitoring and clinical care for infants at 32 weeks and older. The team of skilled nurses, pediatricians, and family practice physicians, along with Medical Director Dr. Daniel Kwok, neonatologist, help Ashley Regional Medical Center offer your infant excellent care right here at home.
Welcome back, and thanks again for joining us. We're talking about environmental concerns that could affect Basin residents. We talked a little bit about water labs, and radiation fears and myths and concerns. Let's talk a little bit about air quality now. What can you tell me about what we ought to be concerned about as residents of the Basin?
Well, we've had some concerns about air quality for quite some time. We set up a monitor here in 2006 because we were concerned about air quality, and those monitors indicated some high levels of particulate matter in the air. But it's costly to monitor for air quality. So we've been petitioning the state and the governor to put some money.
You mean as an ongoing thing?
Yeah,
you can just kind of monitor now and then stop?
It's expensive to run those monitors. It's expensive to run the tests. I mean, you have a cartridge filter that you fill with particulate matter, and then you send it off to a lab, and it just gets very expensive. And so we've been pushing to get some studies done. We've talked to the governor, and they put some money into studying our air quality this winter.
All right. So you have reason to believe in the TriCounty area, our TriCounty area, that maybe we ought to monitor this, take a look at it. There could be some concerns. There
are some concerns. From what we've tested, the particulate matter's high and the ozone's high. That money was given to Utah State University. So Utah State University, the Vernal campus here, is doing that air monitoring and those studies right now.
Well, how does that work, Darren? It seems like we're in a rural area, and fresh, clean air, that should be our thing, shouldn't it?
Yeah.
You have big factories and all the stuff that the average guy thinks pollutes the area. How are we getting this stuff?
Yeah, the time that our air is bad is in the wintertime, and you've probably seen our winter air inversions.
That's when we get all that cold air trapped down in here.
Cold air
We're stuck breathing the same old stuff again.
Yeah, that cold air gets trapped here, and we get the buildup of particulate matter and ozone. And it's unique to the basin. There are some other areas around the country. Pinedale, Wyoming has seen some of that also.
Is it our geography?
It's our geography.
That creates some of that. When you say a buildup of ozone, what does that mean exactly? I thought ozone was good.
You're talking about two different things, because we have an ozone layer that's high in the atmosphere, 6 to 30 miles high.
That's good.
That's good, because what it does is protect us from ultraviolet rays from the sun.
But if it's floating around down
here... But if
here,
you're breathing it, it's bad, and that's what happens is we get this ozone at ground level that you breathe, and it's an oxidizer, just like a disinfectant, and it's just not good to breathe. It causes health effects.
We want antioxidants, not extra oxidants. Right,
not extra oxidants.
It's always educational around here.
So
I interrupted you then. There may be some studies going on and possible
yeah, and people have to remember we're at the beginning of it. We're trying to find out what levels of ozone we have, what levels of particulate matter we have, and then we're trying to characterize where those are coming from. Because we're not in a highly populated area. A lot of times you see these air concerns are in populated areas.
That's what I was thinking.
So we're trying to figure out where that's coming from. It gets to be an issue of cost, trying to figure that out, but there is some money put into it now to get it started.
But right now it's just theorizing. When it's really cold and we're in the inversion, we might not have the best air here.
We typically don't.
To breathe.
We don't when we have inversions. In the different winters, the inversions are worse than others.
Right.
I'm sure you've seen.
But summertime?
Summertime, our air quality is good.
It's pretty good.
It actually
is
good.
We would expect it to be. Well, that's very interesting. So we hope to see then some future testing and maybe some ongoing monitoring that happens.
Yeah, the studies that they've done this winter, the results are going to be out soon.
Oh, they will be.
And so when those results are out, it'll tell us what we need to do next year.
All right. We need to be wearing little masks and things like that, or staying inside?
You know, if it's in the middle of an inversion and you have some lung problems, asthma or something, you may need to do that. But
wow. Well, I'm glad you were here. That's good. No need to be alarmed, right? I mean, but it's something that
well, it's something we need to do.
at.
It's something that we need to take care of.
It's a concern.
Yeah,
all right.
It's a public health concern.
All right, and we mentioned just in the last piece that you have a website too. Tell us again that website that you have where people can check out Tri-County Health and what's going on with you all.
It's at www.tricountyhealth.com.
I think I can even remember that. That's pretty easy.
That's a good one.
Well, thank you two for being here, and thank you for joining us. We hope to see you again right here on the next edition of Local Point.